Healthcare access for older adults in the United States is a multifaceted issue that touches upon affordability, availability, and the specific health needs of an aging population. As individuals age, their interactions with the healthcare system tend to increase in frequency and complexity, making seamless access to quality care a cornerstone of their well-being and independence. The United States has a mixed system of public and private health care, and for older adults, Medicare is the primary federal health insurance program. However, navigating this system, covering out-of-pocket costs, and finding appropriate care can present significant challenges. These hurdles are often compounded by geographic disparities, socioeconomic factors, and the digital divide, all of which can impede an older person's ability to receive timely and effective medical attention. Understanding these barriers is the first step toward developing comprehensive solutions that ensure every older American can live a healthy and dignified life. One of the most significant barriers to healthcare for older adults is financial. While Medicare provides a foundational layer of coverage for most Americans aged 65 and over, it does not cover all medical expenses. Seniors are often responsible for premiums, deductibles, co-payments, and co-insurance, which can accumulate rapidly, especially for those with chronic conditions or those requiring specialized treatments. A major gap in traditional Medicare is the lack of coverage for long-term care, such as nursing home stays or in-home assistance with daily activities. This type of care is prohibitively expensive for many families, forcing them to deplete their life savings to pay for necessary support. Prescription drug costs also pose a substantial burden. Although Medicare Part D offers prescription drug plans, beneficiaries can still face high out-of-pocket costs, particularly for new or specialty medications. These financial pressures can lead older adults to delay or forego necessary medical care, skip medication doses, or cut back on other essential needs, like food and housing, ultimately leading to poorer health outcomes and a reduced quality of life. Beyond the direct costs of care, physical and geographic barriers significantly impact access for many older adults. In rural and underserved urban areas, healthcare facilities, specialists, and even primary care physicians can be scarce. This scarcity forces seniors to travel long distances for appointments, which can be a formidable challenge for those with mobility issues, chronic illnesses, or those who no longer drive. The reliance on public transportation, where available, can be unreliable or may not accommodate individuals with disabilities. Even for those living closer to medical centers, physical limitations can make getting to and from appointments a difficult ordeal. This lack of convenient access can result in delayed diagnoses, poor management of chronic conditions, and an over-reliance on emergency departments for routine care, which is both inefficient and more costly for the healthcare system as a whole. The problem is not just about the distance to a facility, but also about the availability of providers who are trained in geriatric medicine and can address the unique and complex health needs of an aging population. The increasing digitization of healthcare, while offering many benefits, has also created a new set of challenges for older adults, often referred to as the digital divide. The shift towards telemedicine, online patient portals for booking appointments and accessing medical records, and digital health monitoring devices assumes a level of technological literacy and access that many seniors do not possess. Some older adults may not own a smartphone or a computer, or they may lack reliable internet access, particularly in rural or low-income areas. Others may struggle with the technical skills required to navigate these digital platforms, leading to frustration and disengagement from their own healthcare management. While telehealth can be a lifeline for those with mobility issues, it is ineffective if the patient cannot log in to the virtual appointment or operate the necessary software. This digital barrier can exacerbate existing health disparities, leaving behind those who are already vulnerable and isolating them further from the evolving healthcare landscape. Bridging this divide requires more than just providing technology. It demands patient-centered training, user-friendly design, and non-digital alternatives to ensure that no one is excluded from care. Social determinants of health, including housing stability, food security, and social support networks, play a crucial role in an older adult's ability to access and benefit from healthcare. An individual living in unsafe or unstable housing may be more focused on their immediate survival than on scheduling a preventive health screening. Similarly, Food insecurity can lead to poor nutrition, which can worsen chronic conditions like diabetes and hypertension, making medical management more difficult and less effective. The lack of a strong social support system is another critical factor. Older adults who live alone and are socially isolated may not have anyone to help them get to appointments, remind them to take their medication, or provide emotional support during a health crisis. This isolation can contribute to mental health issues like depression and anxiety, which are often underdiagnosed and undertreated in this population. Addressing these social determinants is essential for improving health outcomes. Healthcare systems are increasingly recognizing the need to integrate social services with medical care, screening patients for these needs, and connecting them with community resources that can provide support, thereby creating a more holistic and effective approach to senior health. Navigating the complexity of the U.S. healthcare system is a daunting task for people of any age, but it can be particularly overwhelming for older adults who may be managing multiple health conditions and coordinating care among various specialists. The system is fragmented with a confusing web of insurance plans, providers, and billing processes. An older person might see a primary care physician, a cardiologist, an endocrinologist, and a physical therapist, all of whom may operate independently without seamless communication. This lack of care coordination can lead to redundant tests, conflicting medical advice, and dangerous drug interactions. Patients and their families are often left to act as the primary coordinators, a role for which they are typically unprepared. This administrative burden can be stressful and time-consuming, and errors can have serious health consequences. The need for better care coordination, including the use of patient navigators and integrated electronic health records, is critical to ensuring that older adults receive safe, efficient, and well-managed care that treats them as a whole person rather than a collection of separate ailments. In conclusion, ensuring comprehensive and equitable healthcare access for older adults in the United States requires a multi-pronged approach that addresses financial burdens, geographic and digital barriers, and the social determinants of health. It is not enough to simply have a health insurance card. True access means that care is affordable, physically reachable, and easy to navigate. Policies aimed at strengthening Medicare by expanding benefits to include long-term care, dental, vision, and hearing, as well as capping out-of-pocket prescription drug costs, are vital steps toward reducing financial strain. Investments in rural health infrastructure and transportation services can help bridge geographic divides. Initiatives to improve digital literacy and provide non-digital care options are necessary to ensure that technology serves, rather than excludes, the senior population. Furthermore, integrating social services with medical care and promoting better care coordination can lead to more holistic and effective health management. By tackling these challenges head-on, we can build a healthcare system that honors the contributions of older Americans by enabling them to age with health, dignity, and security.